My name is Kari, and I am doing my presentation about chronic obstructive pulmonary disease, or COPD. Chronic obstructive pulmonary disease is when there is damage to the lungs that causes inflammation that can block airflow and make breathing hard for somebody. In this presentation, we will talk about COPD and its impact on the U.S. population, etiology and risk factors, pathophysiology, clinical manifestations and complications, treatment, and nursing evidence-based practice. COPD is one of the top 10 causes of death in the United States, according to the CDC. Around 16 million adults have COPD in this country. The prevalence rate in adults in the U.S. with COPD remains unchanged between 2011 and 2022. Women have a higher prevalence rate than men. Of adults aged 45 and older, death rates decreased from 1991 to 2021. The medical cost of COPD in adults over 45 is about $24 billion each year. The prevalence rates and mortality from the CDC is shown in the charts to the right. Smoking tobacco is the main cause of COPD in the United States. Other risk factors include breathing in any toxins in the workplace or just in the environment, family history of COPD, and asthma. In COPD, there is an inflammation in the airways, alveoli, alveolar ducts, bronchioles, and blood vessels in the lungs. Neutrophils and macrophages release inflammatory mediators. All of these parts of the lungs contribute to gas exchange. COPD causes hyperinflation of the lung due to air trapping from a collapsing airway when a person exhales. When a person cannot fully exhale, they will have higher CO2 levels. Clinical manifestations include coughing, wheezing, shortness of breath, trouble taking breaths, and excessive mucus. Complications include having trouble doing normal activities, walking, taking stairs, trouble concentrating, poor mental health or overall health, and may coincide with other diseases such as asthma, heart disease, or diabetes. There is no cure to COPD, although you can change modifiable factors such as smoking. Also, you can do treatments to reduce your symptoms. Treatments include oxygen therapy, bronchodilators, and inhaled steroids, and high-frequency chest wall oscillation, which is basically just a vest that patients wear and it beats their chest to make them cough up mucus. The American Lung Association recommends that patients and healthcare providers complete an action plan for their COPD together. This is shown in a green, yellow, and red zone to go over how the patient is feeling that day and what treatments to complete. The nurse should educate the patient on taking their daily medications, using their oxygen, using their inhaler as needed, stopping smoking, and using pursed lip breathing if needed.